So, good afternoon, everyone. Today, at the Teaching Center of Osstem in Mumbai, we are conducting a suturing hands-on for the basic masterclass. And today we'll be demonstrating an incision pattern and suturing on 4 to 5 suturing techniques that can be used for basic implantology. My name is Dr. Varun Pravalkar. I'm a maxillofacial surgeon, and today we have our first batch in January for basic masterclass. So with me here is Dr. Mahesh, who will be assisting me in my procedure. Okay. The whole procedure is going to happen on this unfortunate chicken, which has donated us his foot, and we are going to do an incision on it and show some incision techniques. Okay, would you be kind enough to hold this? All right. The first basic principle of the incision is for the grasp, and the grasp of the BP handle should be a modified print grasp. And when you are taking an incision, if you are making an incision, remember to have a finger support with nearby structures. Mostly it is taken on the teeth, adjacent teeth, or the bone, and at that particular with that particular support, you go ahead with incision. Now remember, for incision should be taken in one stroke. So in your mind, you take a virtual incision first, and then followed by a real incision. Now, I'm trying to take a full thickness flap over here. Also, if we can demonstrate of how the periosteum will look like in the patient's mouth. This particular portion of the chicken mimics the alveolar bone, and that's why we have selected this particular specimen. And we would be giving a full thickness incision. Okay.
Light. Camera.
Okay. If I put the light, you can't see.
Light from your loop.
Should I take it out?
Yeah.
Okay. Better?
Yes.
All right. Okay. Going to the incision. Always take the incision, as I mentioned in my lecture just before that the incision should be always taken towards you. So it always has a better control if you take the incision towards you rather than away from you. So I'm going towards the bone, and we are taking an incision all the way towards the bone. I've hit the bone, and now I'll be pulling the blade towards myself, making around a 1 inch of incision. Okay. Once my incision is complete, then only I'm withdrawing the blade like this. The work of the blade is over for now, so I'll be keeping it over here. At the same time, I would like to demonstrate if we can see something which mimics the periosteum. At the bottom of it, you can see some muscle, some ligament present, which we will not see in the oral cavity. But at the bottom of it, at the same time, you'll see the white, transparent white structure over here. Are you able to see?
Yeah.
Okay, and that is periosteum. Now I'll be separating the periosteum like this, and you can see the periosteum inside, how thin it is from inside. So shiny material present over there. There, can you see that? This is a clean exposure of the bone. That's how it looks like. This is pure bone, and this is how this thin membrane-like structure is periosteum. I have already in my lecture have mentioned the importance of periosteum as the important structure to prevent any destruction of the periosteum, which in turn will prevent cervical bone loss around the implant, because 75 to 80% of blood supply of a cortical bone comes from the periosteum. So our flap is complete, and just imagine that our surgery is over as well. We will be closing this particular wound. We will be closing this primarily, so it's going to be a primary closure. I will be demonstrating vertical mattress, horizontal mattress, cross mattress, and if possible, a continuous mattress. The suture I have in front of me is a 4-0 silk with a 16mm needle and 3/8 circle angulation. The needle is cutting type. Always hold the needle little away from the end. There we have a suture. Okay. Be careful with your fingers. Yes. All right. Remember that what usually is missed, that dentists tend to do suturing with one hand. Okay. What are they doing with the other hand? And most of the time, retracting retracting the cheek with the finger. Okay. That is two-hand dentistry. Not recommended in implantology. We require four-hand dentistry where retraction is done by an assistant. Okay. Your other hand, your left hand or non-dominant hand, should always hold a soft tissue forceps. These are usually Adson forceps, 6 inches, non-traumatic. And that is how, with two hands, you do the suturing. So the one hand, you hold one side of the flat, okay, and enter the suture, stabilize the needle with the tissue forceps on the other side, and then pull it. That way, you cause a minimal trauma. Now, for here, we first do vertical mattress suture. Usual distance from the incision is around 4 millimeter. Okay, and I remember that your entry and exit should be always similar. So 4 millimeter from one side. Okay, you hold the flap, you secure the needle, you pull it. On the other side as well, you're planning to have a 4 millimeter distance. Again, hold the tissues a 4 millimeter away. You pull the suture all the way, leaving somewhere around 1 or 2 inches from the other side. Now is your job to go to the same side again. This time, your entry will be 2 millimeter away from the incision. And again 2 millimeter away from the other side of the incision to mark the exit point. Always have to make sure that all of these 4 points should maximum come on the straight line. Do you understand the meaning of that? Entry, exit, all of them in a single line. Okay. Over here, you may put a surgical knot. The definition of surgical knot varies with a different region and different people. Okay, remember while suturing, I've seen most of the students, most of the dentists, they hold the needle holder like that and they go round and round around the needle holder. Is it correct? Yes, please avoid that habit. Make sure your left hand is stable. What moves is your right hand or the dominant hand. Okay, you go 1, you go 2, at the second turn, you open the needle holder. Okay. Grab the end of the suture and close it. As I'll close, you will see a slight amount of tissue eversion over here. Okay, that is what is desired. This tissue eversion is necessary. It's a little bit of strangulation of tissue, although tissue will not undergo necrosis, but it will in turn turn into a keratinized tissue. There you go, a completion of a vertical mattress suture. Cut the ears, and there we have a suture. The second suturing technique I would like to demonstrate is a horizontal mattress suture, also known as a box suture. Over here, your entry and exit point are distributed at the same level, okay, and they are distributed on a wider area so that it covers the wider area. Again, this is an excellent suture to cause eversion, and at the deeper level, again, it causes eversion of the tissues, creating keratinized tissues. Distance I'm recommending over here is somewhere around 3 millimeter from the incision line. I stabilize the tissue, okay, enter, exit. Other side again stabilizing with the soft tissue forceps. 3 millimeter away in the same line, leaving somewhere around an inch or more. Going to the same side, 3 millimeters away again, and again. Stabilize the needle with the tissue forceps, and there you go. Hold the soft tissue, pull it out, and there we have it, a horizontal mattress suture. Again, remember, whenever you're knotting, don't move your left hand, your right hand can be moved, okay? Grasp the suture, pull it towards each other. When you pull it, you'll see a slight bit of eversion present over there. There you go, that's it. Third technique I would like to show for the basic implantology is a cross mattress suture. A cross mattress suture is a popular suture among dentists for the closure of the socket, especially if you have done a socket management, like you have put a gel foam or a graft inside the socket or a PRF, and you want to close that socket with the particular suture, then cross mattress becomes an ideal suture. Cross mattress will pull the tissues towards the center of the suture, and that is very good when it comes to secondary tissue healing like extraction socket. It is also a good suture in the incident line when you have something to hold on to underneath, like a soft tissue graft or a membrane. It creates a hammock-like structure and it supports that particular structure while closing and drawing attention towards the center. All right, it's similar to horizontal mattress, but at the same time your entry and exit point differ. Again, entry, I'm doing 3 millimeter away from the tissue, taking it out. Instead of going parallel to the first entry, I'll be going cross, that is somewhere over here. Again, 3 millimeters away. Stabilizing the tissue, pulling it. Stabilizing the needle. My second entry point would be parallel to the first entry point, and my exit point would be parallel to the first exit point. So second entry to the first entry parallel, again 3 millimeters away, like this. An exit point, second exit point parallel to the first exit point. Okay. When I close it, it will look very similar to the box suture, okay, or a horizontal mattress on top. But if you explore it inside, how it looks like, you'll see a cross like that. Okay, that's the cross mattress. This is a cross mattress inside. When I'll tighten it, again it will show some sort of eversion, and it can support the structures which are underneath. So these are the three suturing techniques which we discussed for the interrupted suture. Okay. The fourth technique I would like to exhibit is the continuous mattress suture. Continuous mattress suture is an excellent surface suturing technique, provided that your deeper layer suturing are secured. Okay. I'm going to take a new chicken foot if it is there. Continuous mattress suture are fast sutures. They take very less time. Time is very essential when it comes to implant surgeries. We cannot ask the patient to keep mouth open forever. Okay, but it has a fallout, a drawback, that if one of the knot fails, the entire suture will come out. And that's why these are only treated as a surface suture. It requires deeper level suture, usually deeper level suture, which are given along with the continuous mattress suture or horizontal mattress suture. Okay, and then on top, you can go ahead with the continuous mattress suture. Continuous mattress suture is fast and efficient. Okay, it saves time for the knotting. It just has two knots, one at the beginning, one at the end. Again, just like interrupted suture, a classic interrupted suture will be our first suture. I'll secure it. I will not cut both the ends over here. I'm going to cut only the shorter end. With the longer end, I'll continue giving the loops for the suture. Over here, the assistant has a role of maintaining the tension for the suture, as known as follow, okay, which I will just explain. What is the assistant's role over here? The distance between the loops should be similar. Let's say over here, I would like to keep around 5 millimeter distance. To maintain the tension, I will ask the assistant to hold it vertically like that. Otherwise, the suture will become loose. Leave. That's good. Hold it again. Leave. Hold. Entry, smooth entry and exit. You'll see how fast we are covering a very long incision. Long incision in terms of implantology. The environment in oral cavity is unique, and it's not going to be so simple to just conduct suture when you ask the patient's cooperation over here. Here, the patient is very cooperative. I'm already reaching the end of the suture. It would have taken 4 times more if you should have done just the interrupted suture. This is how fast the continuous sutures are. Now the question comes is how at last we do the second knot, which will secure the suture entirely. And that is not very difficult. Don't have a tension on my needle. At the end of it, you don't have the other end. So we'll use the loop as the end. There you go. Hold it tight and close. Correct? Another loop. And one more. And that's how we are doing a continuous mattress suture. Both knots will be always on the opposite side. One at the start, one at the end. That is good. So this must, in 1 inch suture approximately, we finished it in few minutes. Okay? So that is to save time, provided that the deeper level sutures are already been given. Okay? One more technique over here I would like to exhibit, and that is another form of a continuous mattress. That is a continuous locking suture, or also known as running locking suture. Let's try to give this suture. Okay, somewhere another incision. I'll show you how unique that incision is. Okay, small incision. This is tough compared to the oral mucosa. Okay, so even the thicker needle, it struggles to enter. All right. Again, it starts exactly like a normal running suture. A singular knot. There you go. Cut again the shorter end. And now it's very similar to the running suture, but it is with the locking mechanism. Over here, what we do is we pass the needle through the previous loop, like this, through the loop, like this. Give a tension with the needle holder, release the needle, and there you go. There is a lock on one side. Do you see that? Okay. Now, again, my assistant, it needs to give the tension, maintain the tension over there. My suture is getting smaller. Another loop. Leave. Again, go backwards towards the loop. Here we go. Hold it. That's a running locking suture. And you can see the locks being there on the one side. Advantage of this suture over the regular running suture is it's more secured and puts a pressure on the flap on one side. Usually that flap would be a mobile flap. Hold it. Here, there's the scales coming out. Here. Chicken's closest relative in history have been Tyrannosaurus rex. Are you aware of that? Good. All right, I'm done almost. Okay, I'm going to put a last knot. There you go. And there is our running locking suture. So these were the few techniques for you to practice at home. If you do not have access to chicken feed, you can use oranges, raw banana, or fruits or vegetables like that, and do the practice with the sutures. Make sure that whenever you're using a suture, you use an authentic suture with the needle which is eyeless. The needle which is eyeless always. That is what is expected, because the other needle will cause trauma to the tissues. And keep practicing until you ace the technique. These are the basic techniques. When we go to advanced implantology, the techniques change according to the volume of the bone underneath. And I thank Osstem for giving me the opportunity over here to put in front of you certain suturing techniques, especially for a young implantologist. And I hope you have learned something good and you will practice at home as well. Well, thank you so much. Thank you so much.